You know that persistent back pain? The kind that just hangs around, and maybe your scans, they don't really show the usual stuff, like a major disc issue.
Right, yeah, it's really common. And often people focus only on those big discs or the main nerves.
But today we're diving into something maybe a bit less obvious.
Exactly. We're looking at the facet joints. Think of them like tiny hinges along your spine.
Hinges, okay. Like in your knuckles, maybe?
Sort of, yeah.
Mm.
They allow for all that bending and twisting we do.
Yeah.
Little joints doing a big job.
And like any joint, I guess they can wear down over time. Like door hinges getting old.
Precisely. That constant movement, the wear and tear, it can lead to inflammation and, well, pain.
Okay, so how does that pain? How does it actually get signaled? Is it the main spinal nerves?
Ah, good question. No, it's actually these really small nerves called medial branch nerves. Very specific.
Medial branch nerves. Okay, and they're different from the ones that say control my legs.
Completely different. These medial branch nerves, their main job, really, their only job is to carry pain signals from those specific facet joints.
So they don't handle sensation like touch or tell muscles to move?
Nope. Purely pain messengers from that one spot. That's it.
Okay. So if you suspect these little facet joints are the problem, how do you confirm it? How do you test those nerves?
Well, that's where something called a medial branch block comes in. It's a diagnostic procedure.
A block. So you're blocking the nerve.
Temporarily, yes. We inject a small amount of local anesthetic, numbing medicine, right near those medial branch nerves.
Ah, okay. So it's like flicking an off switch on the pain signal for a bit.
Exactly. If the facet joints are indeed the source of the pain, numbing the nerves that carry that signal should give you relief.
Significant relief.
Ideally, yes. Significant relief for a few hours while the anesthetic works.
So it's not a permanent fix then? It's really just a test.
Correct. Think of it purely as a diagnostic test. The relief is temporary, maybe just a few hours.
But those few hours are key, right?
Absolutely key. If the pain significantly drops during that window, it's a strong indicator that, yes, those facet joints and the medial branch nerves are the pain generators.
Okay, that makes sense. So let's say the test works, the block provides relief. What happens next? You can't just keep getting temporary blocks, can you?
No, you wouldn't. If the block is positive, meaning it confirms the source, then we can consider a longer-lasting treatment called radiofrequency ablation, or RFA sometimes.
Radio frequency ablation.
Yeah.
What does that involve?
It uses heat generated by radio waves to essentially disrupt those specific medial branch nerves so they can't send pain signals effectively anymore.
And how long does that relief last?
It varies, of course, but often people get relief for, say, 6 to 12 months, sometimes even longer, much longer than the block.
That sounds promising. Now, thinking about the block itself, the test, is it painful? What's the procedure like?
Most people find it very manageable. There's usually a brief sting from the numbing injection itself, like any shot. The whole thing takes maybe 15 to 20 minutes.
And you go home the same day.
Oh yeah, it's an outpatient procedure. You're in and out pretty quickly.
So let's recap for someone listening. If you've got that nagging back pain, the kind that hasn't really improved with other treatments, and maybe your scans look relatively clear,
Then exploring whether your facet joints are involved could be really worthwhile. This medial branch block is a way to specifically investigate that possibility.
it pinpoints the problem.
Exactly. It helps pinpoint if these small joints are the issue. And if they are, it opens up treatment options, like the RFA, that directly target the source.
Right. So a really important takeaway here is that a medial branch block isn't the treatment itself, but it's the crucial diagnostic step.
Precisely. It tells us if targeting those nerves is the right path forward for longer-term relief.
So a final thought for you listening. If that persistent back pain feels like a mystery, could these tiny facet joints be playing a bigger role than maybe you or even your doctors initially thought?
It's definitely something to consider and maybe discuss with your healthcare provider. Could this test shed some light